Hello and welcome to this podcast on dementia and wound care, looking beyond the wound. Thank you to the Leg Club for inviting me. I'm Samantha Holloway, reader and programme director for the Masters in Wound Healing and Tissue Repair at Cardiff University School of Medicine. Today I'd like to talk about something that affects many families and carers. That is how dementia can influence wound care and why caring for a wound is often about much more than wound itself. When most people think about dementia, they think about memory loss, but dementia affects many aspects of daily life, including communication, decision-making, behaviour, mobility, and the ability to express needs. These changes can make wound care more challenging, both for healthcare professionals and for family members supporting someone they love. So let's explore why this matters and what we can do to provide better care. Before we go any further, I'd like to share a story. Let's imagine Mary, an 82-year-old woman living with dementia. Mary develops a wound on her lower leg following a minor knock at home. The wound itself isn't particularly complicated, but attending appointments and having dressings changed becomes increasingly difficult. When a nurse arrives to change her dressing, Mary becomes anxious. She doesn't remember why the nurse is there and doesn't understand why someone wants to touch her painful leg. She pulls away, becomes distressed, and says, "Leave me alone." To someone watching, it might look as though Mary's refusing treatment. But when we look more closely, we see something different. Mary's frightened. She's confused about what's happening. She's in pain, but struggles to explain it. The situation feels unfamiliar and threatening. Now imagine a different approach. The nurse sits down at eye level, introduces herself slowly, uses Mary's name, and spends a few minutes talking about the photographs of Mary's garden displayed around the room. She explains each step before carrying it out and allows Mary to make simple choices along the way. Gradually, Mary's anxiety reduces. She feels safer, more involved, and more willing to accept treatment. The wound hasn't changed, but the experience of care has. And that's really what today's podcast is about, understanding how dementia can change a person's experience of wound care and how small changes in our approach can make a significant difference to both healing and well-being. Dementia is an umbrella term for a group of conditions that affect the brain. It can impact memory, thinking, behaviour and communication, and over time these changes usually become more significant. Around the world, millions of people are living with dementia, and as our population ages, more people receiving health care, including wound care, will also be living with the condition. At first glance, wound care and dementia might not seem closely connected. But imagine having a painful wound and not being able to explain exactly how it feels. Imagine not understanding why someone is changing a dressing or touching a sore area. Or imagine feeling frightened because the situation feels unfamiliar. For someone living with dementia, these experiences can be very real. As dementia progresses, people may find it harder to communicate pain, understand instructions, or remember why treatment is needed. This can sometimes lead to distress, resistance, or withdrawal during care. Importantly, these behaviours are often not a deliberate refusal of care. They may simply be expressions of fear, confusion, discomfort, or an unmet need. One of the biggest challenges is recognising pain. Many people living with dementia cannot easily describe where they hurt or how severe the pain is. Instead, pain may appear as agitation, restlessness, changes in mood, or unusual behaviour. A person who seems angry, distressed, or withdrawn may actually be trying to communicate discomfort. This means healthcare professionals and carers need to pay attention to non-verbal signs and behavioural changes rather than relying on what a person says. Recognizing and managing pain effectively is an important part of wound healing and overall well-being. People living with dementia may also face other challenges that affect healing, such as reduced mobility, which can increase the risk of pressure ulcers or bed sores. Poor nutrition or dehydration can slow wound healing. Fragile, aging skin is more vulnerable to damage. And difficulties with personal care or continence can increase the risk of skin problems and infection. So when we care for a wound, we're rarely treating just the wound itself. We're caring for a whole person with a unique set of physical, emotional, and social needs. One of the most powerful tools we have is communication. Simple approaches can make a remarkable difference to someone living with dementia. So speak slowly, use clear language, make eye contact, explain each step before carrying it out, and offer simple choices whenever possible. For example, rather than telling someone what is going to happen, we might ask, would you like me to start with this arm or that arm? Small choices can help maintain a sense of control and dignity. Just as importantly, validating a person's feelings can help reduce anxiety and build trust. A key principle in dementia care is something called person-centered care. This means seeing the person before the condition. Every individual has their own life story, preferences, relationships, and experiences. A wound may only take minutes to dress, but the way we provide that care can have a lasting impact on how the person feels. Taking time to learn about what matters to someone, involving family members where appropriate, maintaining familiar routines, and adapting care to individual preferences can make treatment less frightening and more successful. So instead of asking, how do I get this dressing done? We might ask, how can I help this person feel safe and comfortable while we do this together? That small shift in thinking can transform care. So what are the key messages? Dementia can affect communication, behavior, pain recognition, and a person's ability to engage with treatment. People living with dementia often face additional challenges that can affect wound healing. Pain and discomfort may not always be expressed in obvious ways. And most importantly, successful wound care depends on seeing and supporting the whole person, not simply treating the wound. By combining good clinical care with empathy, patience, and person-centered approaches, we can improve both healing and quality of life. Thank you for listening.